Hello, everyone. Hello, good evening, good afternoon. Welcome to the Functional Solutions Podcast. I am one half of the co host team, Dr. Sarah Ellis, and I'm joined with the wonderful Dr. Tall. How are you today?
Doing well, doing well. It's great to be here, and I can't complain. It's sunny here in Portland, 65 degrees, so I'll take it any day of the week.
Yes, absolutely.
And I know that you're in the East Coast, so over there, it's I think you guys starting to get some of that warmer weather.
Yes, this past weekend was very warm, so warm that the alligators and snakes were out a little bit.
Oh,
So
nice.
yes, the critters are started to enjoy the springtime as well. But
Yeah.
today was actually a little chilly. I don't
Uh-huh.
know if we had like a false spring last week, but
Oh, yeah, yeah. It's here now, and
yes,
so
exactly,
it's yeah, yeah.
exactly. You guys got to send it back over this way, please.
Uh-huh. Yes.
Well, great. Thank you all for joining us tonight. Again, this podcast is brought to you by the American Academy of Functional Health. And today we have a really interesting topic today. We're going to be talking about osteoporosis. And so it's an important topic, especially for postmenopausal women, and particularly because osteoporosis is a progressive condition. And so, as functional medicine providers, this is the perfect opportunity for us to support our patients by encouraging good bone health, as well as supporting postmenopausal women with a variety of different options to help keep their bones strong. Now, from a functional medicine perspective, osteoporosis is not just a calcium deficiency. It's actually a multifactorial condition, and it is influenced by hormones, gut health, inflammation, and nutrient absorption. So, Dr. Hall, when you have a patient presenting in office with either osteoporosis or osteopenia, what's the first thing that kind of comes to your mind when you're putting together a treatment plan or protocol for them?
Yeah, that's a really great question. So it's interesting how, if you ask a primary care practitioner about what are the treatment options for osteoporosis, they're gonna probably talk to you about the different drugs to manage the condition, right? However, if you ask an integrative medicine practitioner, they will most likely, if they're well trained in clinical nutrition, they'll think about the different nutritional aspects, the lifestyle. And of course, if you ask a functional medicine practitioner, then they will think about what are the root causes of osteoporosis, right? So the question that a functional medicine practitioner asks is not how we can manage this condition, but what's causing it,
Yes.
right? Why do some people struggle with osteoporosis and some people don't, right? What's leading to the decrease in bone density? And so, if you're interested in learning more about the root causes of this condition, as well as treatment strategies from integrative medicine, you are in the right place, because we're going to talk about both of these different types of approaches today in this class.
Yeah, awesome. And focusing on the root cause and the foundations of kind of what developed or what caused that condition to develop, is such a important piece when it comes to being a functional medicine provider. And when thinking about osteoporosis, it's important to kind of take a broader vision and look and vantage point at the condition and really see how it impacts our community. And so, why we picked this topic, we picked osteoporosis because it's actually a major public health concern, which may be surprising to some folks, but it affects an estimated 10 million Americans, and not just women. Men can develop osteoporosis as well. Now, there are another 44 million men and women who are at risk of low bone mass and low bone density. Now, unfortunately, it does disproportionately affect postmenopausal women. In fact, one in two women over 50 will experience an osteoporotic fracture in their lifetime. So let's take a picture or look at this picture, this image, which does a really great job of helping to really quantify how this condition affects our community. So, like I said, 1 in 2 women will experience an osteoporotic fracture in their lifetime, and that's 1 in 4 men over 50. And so, if you think about the number of patients that you have over 50 in your practice, then begin to think about how many women are likely presenting with bone density issues, and same for men. Now, let's take a look at another photo, another picture. This picture is from the Bone Health and Osteoporosis Foundation. And I thought it was so interesting because it really does a great job of highlighting the impact that osteoporosis and osteopenia has on the community at large. And so each year in the US, approximately 300,000 hip fractures occur. Now, 75,000 Americans who experience a hip fracture actually die within the year following the fracture. And another 75,000 Americans move from the hospital to a nursing home and they never return home. The remaining 150,000 Americans never regain their previous function. 6 months after a hip fracture, only 15% of patients can walk across the room unaided. That is so sad. Those statistics actually made me so sad because there are quite a few things that we can do, especially as functional medicine practitioners, to support healthy bone management, as well as supporting, healthy postmenopausal bone health as well. And so let's take a moment to go to a quiz really quickly. And so, um, actually, let me get 1 second. Sorry for the technical difficulties. While we're waiting on the quiz, Dr. Tall, um, I wanted to take a moment to chat a bit about osteoporosis and men. Um, as a provider, how often have you seen osteoporosis or osteopenia in men? And if so, what are some common conditions that precede it? Oh, I think you might be muted.
That's a really good question because most of our experience that comes from using a more functional medicine approach in our practice actually comes from female patients, which is kind of matches the statistics that you are showing, right? We had male patients with osteoporosis, and they were typically elderly patients that had a wasting syndrome, right? So they were losing muscle mass and bone mass. So that happened, but typically an older age. They're coming in their 70s, or and at that point there's multiple factors, and we're going to talk about 3 of those major factors that we really want to address today if we want to help them in the long term. And then sometimes we get patients that most of them coming into functional medicine because they tried a medication, right? And it did not work well for them. And sometimes they're coming in not necessarily because they are looking for functional medicine, right? Sometimes they don't even know what functional medicine is, but they're coming in because they're looking for natural solutions to the osteoporosis medications. And it is well known that these medication side effects could include anything from upset stomach, acid reflux, right? Inflammation of the esophagus, right? So there's and some medication we also know that have a risk, right? Can increase the risk of hip fracture, right? We can, for example, some interesting studies show that if a patient uses PPIs, right, which happened to us before, we had a patient on PPIs, PPI medication, and also struggling with osteoporosis. So we had to explain to them that PPI medication increases the risk of hip fracture. Some surveys showed between 20 to 62% increase of risk. So some patients just don't want to be dependent on medication that doesn't make them feel good. So that's really the two major reasons why patients will come in. And we're going to talk about three major factors that that contributes, right, in a functional medicine approach. And we're also going to give you some simplified recommendations afterwards for some nutritional or supplement that can help with osteoporosis. So those would be like a quick reference that we've prepared for you during this podcast. So, but first, Dr. Ellis, we got a quiz, a little quiz to warm up with.
That's right. We sure do.
Okay.
All right, everyone. Our quiz is coming up, first one of the night. This one, you might need to dig into the brain and recall our bone anatomy and bone physiology. But which of the following best describes the relationship between osteoblasts and osteoclasts in healthy bone remodeling? A, osteoblasts and osteoclasts work independently and rarely interact. B, osteoblasts break down bone while osteoclasts build it up. C, osteoclasts resorb bone and osteoblasts follow behind to lay down new bone matrix. Or D, osteoblasts trigger inflammation to stimulate bone turnover. We'll give you all a few seconds to put in your answers in the chat. And again, the question is, which of the following best describes the relationship between osteoblasts and osteoclasts in healthy bone remodeling? And if you chose C, that is correct. Osteoclasts, they munch on the bone. So whenever we were in medical school, clasts chew the bone, and osteoblasts build the bone. So we're going to get more into that and into the details of that specific mechanism of action later on in the episode, because the interaction between osteoblasts and osteoclasts play a huge role in the development of osteoporosis and is also one of the root causes behind it. So, Dr. Tall, can you kind of kick us off with starting with that first root cause of osteoporosis? Oh, I think you're muted.
And thank you for going over this little quiz and reminding us, shaking the dust off the old biology 101 or anatomy and physiology, right? For some of us, it's been a while. So just hold on to that thought that Dr. Ellis was talking about, that osteoclasts munch on the bone and reabsorb bone while osteoblasts build it, because we are going to go into the first root cause and how it's all connected, right? How these two are, what is the major factor that impacts these two components, right? So the first factor we're going to go in functional medicine is the root cause of osteoporosis is chronic inflammation. So we've talked a lot about chronic inflammation before. It is a major player in the development of so many chronic conditions, including osteoporosis. Inflammation, essentially, when we dive deeper into the bone, osteoporosis disrupts this delicate balance that we have between the osteoclast that break down the bone and osteoblasts, right? So let's take a look at this interesting picture published in the Journal of Frontiers, the Journal of Frontiers in Immunology in 2021. So when we teach functional medicine, we love to use visuals because it helps us to understand the concepts much quicker. And so on the left side, we see bone homeostasis, right? That's a healthy situation. And so we have a more balanced, a healthier and balanced levels of activity between the osteoblast and osteoclast, right? So we're building, remodeling, and we are removing bone, right? Removing bone mass at the same time. So we're keeping a healthy bone mass. Now, this harmony is really, really important. Now, as we age, we know when we get to about the age of 35, that's where we build much more than we destroy, right? And unfortunately, from the age of 35, there are shifts in our body, like hormonal shifts, and then there's shifts in our metabolism and bone metabolism, right? Now we're not going to go into all of these hormonal, endocrine, neurological, all of these different shifts that happen as we age. We have a whole class in the advanced program just dedicated to that and how to mitigate that. But when we focus on the bones, right, you can see on the right side what happens in an unhealthy situation, right, where you have more bone reabsorption than bone formation, right? Now, the immune system plays a really important role in the development of osteoporosis. Now, the research, the studies have created a term for it, which is called immunoporosis, right? And essentially, immunoporosis is a term that describes how the immune system play a role in loss of bone mass. And we're going to get into a little bit of the explanation. So on the right side, you see the pro-inflammatory cytokines, right? So the reason we're showing you this is because we want to understand what leads to this imbalance, right, between the osteoblasts and the osteoclasts, right? So osteoclasts destroy our bone mass, right? And osteoclasts are derived from macrophages and monocytes. Now, these immune cells also secrete pro-inflammatory cytokines such as tumor necrosis alpha, tumor necrosis factor alpha, interleukin 1 or 6 that stimulates the osteoclast activity, leading to accelerated bone reabsorption. So essentially, think about it like this. If your patient has systemic inflammation, right, or chronic inflammation, these inflammatory cytokines can induce and stimulate excess activity of the osteoclast and lead to more bone reabsorption than we can build, right? Now, also see under pro-inflammatory cytokines inside the circle, there's a concept that is called RANKL. That's RANKL. It's really small, but it is RANKL. And essentially, RANKL is receptors activator of nuclear factor kappa B ligand. So basically, it's just a fancy name to describe a protein that plays a crucial role in bone metabolism and immune function, particularly in osteoclast differentiation, activation, and survival. So in a healthy system, this protein, RANKL, right, is balanced, right? Right, it's balanced. So there's a balance between the amount of osteoclast and osteoblast. However, if you have chronic inflammation, this RANKL protein, right, it's a member of the tumor necrosis factor family of cytokines. It leads to more production of osteoclast that, as Dr. Ellis mentioned, the osteoclast munches on the bone, right? So we don't want excess activity of RANKL. We want it to be controlled, right? So in osteoporosis, that balance is unfortunately disturbed because of inflammation. That is one of the major root causes. Now, there are probably 4 or 5 different root causes, if not more than that, but this is a major one to talk about. Now, there are obviously different factors that can lead to that. We have to consider endocrine imbalances. There are certain endocrine imbalances that are associated with more inflammation. There are there are inflammatory foods, there's environmental factors, there's so many different factors that can lead to inflammation. Once you have inflammation, you also have oxidative stress, which is another mechanism that increases the expression of rankle and increase the activity of osteoclasts, right? So one of the biggest problems with looking at with just prescribing a medication to a patient for osteoporosis and sending them home is that if we do not address the root causes of the inflammation, these patients will have ongoing overactivation of these proteins. There's inflammatory cytokines, this protein rankle, and then excess activity of the osteoclasts. So we're going to have constantly destruction of the bone, right? So that's where it's so important. This is one of the major factors. And I mentioned a few names of different cytokines, right? And when we go into functional immunology, we dive a little bit more into these cytokines and how to impact each one of them using nutritional and herbal compounds. But before we kind of wrap our discussion on inflammation, I wanted to do a little quiz just to see what you have, your level of understanding of the following inflammatory cytokines, and which one of those is mostly associated with increased bone reabsorption in osteoporosis. So I'll give you a few options. Option A is interleukin-10. Option B, tumor necrosis factor alpha. Option C, insulin. Option D, TGF beta. And so I'll give you a few seconds to kind of think about what do you think that is the what do you think the answer is? Which one of those is most associated with these issues? And by the way, TGF beta is transforming growth factor beta, which is also a multifactorial cytokine. So just throwing it out there, right? So which one of these do you think? You can put it in the chat. Which one of those do you think is mostly associated? And I'll give you a little hint. I mentioned it in the inflammation discussion, right? So we're gonna show you the answer in 4, 3, 2, 1. So the right answer is tumor necrosis factor alpha, and so that's B, tumor necrosis factor alpha, and we mentioned that rankle, the protein that stimulates the osteoclast, is a member of the tumor necrosis factor family of cytokines, right? So this is one major inflammatory cytokine that pushes other inflammatory components, right? And pushes the bone towards destruction. Now, if you're interested in learning more about the impact of chronic inflammation, a little more specific treatment protocols for how to mitigate inflammation, resolve inflammation that could impact our metabolism or bone health, you're welcome to check out the Advancing Clinical Functional Medicine program. And remember that the reason we're doing these classes is to really inform the population of practitioners, the medical community, that we have to provide long-term solutions to our patients and help them to improve their function. We have to ask ourselves, what is causing these conditions, right? And it's game changer. Once you start doing that, it's a massive game changing, right? And I know that both me and Dr. Ellis have been working with medical practitioner, primary care practitioner, and it's an amazing approach. And if you are a primary care provider, you can do that integrative approach and learn with us how to do it. If you are deciding to just focus on functional medicine, like some nurses or physicians or PAs are doing in our program, that's welcome too, because it's okay to let other practitioners to manage the patient's condition with drugs while you take care of your patients and improve their health and function. So, and that's a big part of also what Dr. Alice is doing, which is really focusing on figuring out the root cause and helping their patients to get better, right?
Exactly. True integrative care, right?
Exactly.
Yes. We
Exactly.
need all modalities and all tools. Absolutely. I'm so glad you walked us through that beautiful interplay between osteoblasts and osteoclasts, and then looking at how inflammation can actually upregulate the osteoclasts. And so this is a perfect kind of segue into the next root cause to developing osteoporosis, which really is often one of the reasons why we experience so much inflammation, is the gut microbiome. As we may or may not know, some of you may or may not know, the gut microbiome is often a source of inflammation and chronic inflammation. And so addressing the gut is important when supporting a patient with osteoporosis. So let's walk through a couple of ways in which that happens. So we all know that it kind of all starts with the gut. The gut is involved in so many different processes in our bodies, including gut health. I know that there are tons of gut axes. There's the gut brain, the gut skin, the gut liver, and there's also a gut bone axis as well. And that involves the intersection between the gut microbiota, so the bacteria and viruses and fungi and all the microbiome or microbes present in the colon. So it's an intersection between the microbiota, the immune system, and our bones. Dr. Tall did a wonderful job highlighting how TNF alpha and other inflammatory cytokines kind of drive the flow and progression of osteoporosis. And so now let's talk about how the levels of TNF alpha and other inflammatory cytokines begin to rise to the point where they activate that osteoclast activity. And so the gut plays a huge role, a crucial role in bone remodeling by interacting with the immune system and also by influencing hormone regulation, including estrogen and even parathyroid hormone. Now, also, the gut is involved in producing metabolites like short chain fatty acids like butyrate, acetate, and propionate that all play a role in healthy bone remodeling as well. So as we know, osteoporosis, while it isn't necessarily a calcium deficiency disease, the gut microbiome does impact our ability to absorb calcium and other minerals that do play a role in establishing that strong, healthy, bony matrix. So let's take a look at this image from a 2023 review article in the journal Bone Research. I am such a fan of this photo and this image because it does a beautiful job of highlighting the many different ways that the gut microbiome influences bone health. Now, let's start at the top on the left. We have a photo of the colon and zoomed in on those little tiny bugs that exist in the colon. Now, our gut microbiota can impact our immune system by regulating the balance between T helper 17 cells and T regulatory cells. Now, T helper 17 cells are involved in inflammatory processes, but T reg cells or regulatory T cells, I like to call them the fire extinguisher for inflammation. So regulatory T cells come in and they cool off the fire of inflammation, calms everything down so that the healing process and restoration process can begin once the inflammation has cooled off. Now, when there is an imbalance between these T helper 17 cells and T reg cells, then the TNF alpha and IL-6 and all of those inflammatory cytokines are continually flooding the system, and there isn't an option, or it's a slow option to stop that process. Now, the gut microbiota Also impacts our endocrine system. So it impacts estrogen. You all may know, I'm sure you all have learned about the estrobolome. If you haven't, please log into the dashboard and make sure you review it. But the estrobolome is a group of bacteria that lives in the gut that is known to affect the way our body metabolizes estrogen. And in fact, the more bacteria you have that make beta glucuronidase enzyme, the more likely that you have bacteria that's going to be able to recycle estrogen that's already been conjugated and prepared for excretion. It'll recycle it back into the body to lead to excess estrogen. But having an imbalance between estrogen and parathyroid hormone, another hormone that really plays a very, very crucial role in bone health and bone remodeling. If these hormone levels are off balance, then we will see less of a balance in the activity between osteoblasts and osteoclasts, and maybe more likely to see more osteoclast activity, so more resorption of bone, and the osteoblasts just do not have an opportunity to rebuild the bone as quick as it's being resorbed. Now, also, our gut microbiome produces metabolites that impact our bone health. So, again, we talked about short chain fatty acids like butyrate, acetate, and propionate. They play a role in the level of inflammation. Usually, when you have bacteria that create these short chain fatty acids, you tend to have far fewer bacteria that make those inflammatory cytokines. So the more of the healthy bacteria that's there to prepare and make the short chain fatty acids, the healthier the gut will be. There's also the presence that's possible, the presence of polyamines and hydrogen sulfide. Now, these are more toxic metabolites that are usually produced by the quote unquote bad bacteria, the gram negative bacteria, but they also upregulate inflammatory cytokines. And so if you have a patient that's presenting in clinic and you've run a stool test on them and they have low alpha diversity, um, or they may have quite a bit of pathogenic bacteria, inflammatory bacteria. They may be a postmenopausal woman with osteopenia or at risk for osteoporosis. Now you see that there are several reasons why it's going to be important to restore and improve her gut microbiome to further support healthy bone remodeling. And then, of course, the gut microbiota actually influences the way in which we absorb minerals. So again, if you are eating, your patient is eating this great diet that you put them on, full of fresh fruits and vegetables, those dark leafy greens that have those minerals that we need for bone health. If they don't have the proper gut microbiome to help absorb those minerals and nutrients, then they're definitely missing out on the benefit of having that as a diet. Now that we've kind of had a nice overview of how the microbiome impacts gut remodel or bone remodeling and bone health, we have to have a quiz. So let's enjoy our next quiz. The question is, what is the major mechanism of how unhealthy or a dysbiotic gut microbiome contributes to osteoporosis? A, it decreases calcium absorption. B, reduces vitamin D production. C, promotes inflammation and reduces nutrient absorption. Or D, stimulates osteoblast activity. So we'll give you all a few seconds to put your answers down in the chat. And again, the question is, what is the major mechanism of how an unhealthy or dysbiotic gut microbiome can contribute to osteoporosis? And the correct answer is C. A dysbiotic gut microbiome is full of gram-negative bacteria that have endotoxins like lipopolysaccharide and drives inflammation. So a dysbiotic gut is going to promote inflammation and reduce nutrient absorption, which kind of sets the foundation and the stage for osteoporosis. And if you would like to learn more about how to improve metabolic and bone health, we invite you to check out the Advanced in Clinical Functional Medicine program, where you are going to learn specific treatment protocols for patients with chronic disease. Now, Doctors Hall, so we've talked about chronic inflammation, and we've talked about the gut microbiome and kind of how it feeds into the chronic inflammation. Now, the third one I think is really interesting because that's definitely a driver of inflammation and affects the gut microbiome as well.
Yes, absolutely. And I'm so glad that you talked about the gut health, because it is, I know we talk a lot about the gut health. It's a topic that comes up a lot, and it's still a very hot topic, because unfortunately both the gut health, the dysbiotic changes that can lead to inflammation, can lead to changes in our metabolism, and systemic inflammation, the root causes are, it's something that more practitioners should be aware of, and more practitioners should ask their patients, and more practitioners should, if needed, look at the treatment strategies, and sometimes, if indicated, even understand how to utilize the specialty lab testing, right? I know that both of us have, and so many members of our community have been learning how to utilize advanced lab testing, such as the GI360 and NutraEval, and so many different tests that can look at the gut microbiome and say, wow, this is what we have here. These are the metabolites we're missing, we're low at, or we have bacteria that are unhealthy, right? So that's just one of the major factors that contributes to, of course, inflammation, metabolic dysfunction. And so now we're shifting into the third approach, right? The third root cause, which is processed food. And I'll add on to that also nutritional deficiencies, right? And it goes hand in hand, right? So there are several interesting reports that processed food consumption contributes to the risk of osteoporosis. And there's different ways on how we do it, right? One of it could be nutritional deficiencies. So we're going to talk about a few key nutrients that are important for bone mass. And if your patient doesn't get those nutrients, there's nothing to build upon, right? We have to get the building blocks for a body to continuously regenerate itself, right? So that's one aspect of processed food, right? There's so many of the processed foods are lacking essential nutrients. Now, so many of the processed foods also includes very high levels of inflammatory components. I'll give you one example. This is something that even practitioners that came into our program and they studied integrative medicine or functional medicine did not know that you can have a healthier diet, or so-called what we refer to as healthy diet, right? But that includes meat and vegetables and fruits and all of that stuff, right? However, if your diet, and I'll give you one example, if your diet has more omega-6s than omega-3s, which we have tested many of our patients, and we found that what we found in the test results matched the surveys, the general surveys that show that most Americans consume more omega-6 than omega-3, and that leads to a whole cascade of inflammatory pathway. So it puts you in a very pro-inflammatory place. So we're not going to get into that. That's a big topic by itself. And there are ways to shift that. But if your patient is consuming in foods or diets that shifts them to more pro-inflammatory, if they're depleted of some nutrients, all of those can contribute to osteoporosis. So in a functional perspectives, we really want to figure out what is it that our patients are eating and what they could be depleted on. So let's take a look at an image. We love to use visuals. So let's take a look at this picture from a study published in 2020 in the journal Nutrients. So This is called nutrients and dietary patterns related to osteoporosis. And you can see very simply put visually, vitamin D is so critical. I'm not going to get into too much into vitamin D, but we have found that vitamin D in so many cases is a personalized thing. And we had patients that were taking the recommended dosage of vitamin D and they still had deficiencies, right? So the reference range is typically between 30 to 50, but some studies are now showing us that the adequate or optimal, we use the term optimal in functional medicine, levels of vitamin D are between 75 to 110 to prevent those age-related diseases, right? So just going to put it out there as like a pro tip, let's call it that. Higher consumption of protein. Previously, was thought that higher consumption of protein could lead to bone loss, could have negative side effects. What we are learning more and more as we teach, and we have a whole specialty class in the advanced program on geriatric conditions and anti-aging treatment protocols, we learned that protein is one of our best friends as we age, not just to preserve our bone mass, but also muscle mass, which is really important. And so, and then we also have the green leafy vegetables, right? The calcium, magnesium, zinc, all these different, and fruits that have vitamin C, which is important for regeneration of each one of our cells. Now, interesting, vitamin C is, if you ask people what are the purpose of vitamin C, they'll tell you, oh, you take vitamin C for healthy immune system. But vitamin C is really essential for regenerating tissue all across our body. So in our when we would take patients for with osteoporosis into our functional medicine program as a patient, we would make sure that they are getting those essential nutrients, right? That's really, really important. So you got vitamin K, which is important, right? Is essential for bone mineralization. And we're going to talk a little bit more about we'll be going to supplements. We're going to talk a little bit more about the role of vitamin K and why it's so important, right? So vitamin D is becoming famous already. So a lot of patients are taking it, but so many patients are not taking it with vitamin K, which is so important to take them together. So that's just a few pro tips. I've noticed something really interesting about this picture. On the top, when it comes to protein, right, there's a picture of dairy products and milk. So I'm going to ask you a question. Does dairy and milk dairy products and milk, is that beneficial? Is that essential as we were taught years ago? What do you think? Is that essential for bone health or not? I'm going to leave you with that question. And we're going to get back to that question after we talk about the 2 supplements recommendations. So we're going to wrap this section with the nutritional and processed food section with a little quiz. So here's your question. How does frequent consumption of highly processed food directly contribute to the development of osteoporosis? Option A, it increases collagen production and strengthens bone matrix. B, it enhances absorption of key bone building nutrients. C, it disrupts gut health, increases systemic inflammation, and promotes mineral loss through acid load. And D, it directly stimulates osteoblast activity and reduces osteoclast function. Whew, there's a lot going on here, but what I want you to think through the process of elimination, which one of these is responsible, right? Indirectly responsible for the development of osteoporosis. Like, what is this mechanism that we keep talking about that describes that if your patient keeps eating processed food, right, can indirectly lead to or contribute to osteoporosis? So I'll give you a few seconds. to think about it. Think about what we have talked so far in this class today. And you can put it in the chat. You can guesstimate even. You can put it in the chat. So the answer is C. So when your patients are eating processed food, it disrupts the gut microbiome, which leads to an increase in systemic inflammation and promotes mineral loss through acid load. That's just a few of the mechanisms, right? But it's important to recognize that that's one mechanism that explains how we are getting more inflammation that, again, leads to more osteoclasts and higher bone reabsorption. So, Dr. Ellis, I feel like we covered a lot today, right? I know that.
So much. Yes.
Yeah. Then we definitely talk about each one of those root causes in phase 1 of the program. So if you're like sitting there like, wow, this is super interesting, or wow, there's a lot going on here, don't worry. When you log into your practitioner platform, you will learn about each one of those factors and the labs and how to identify it and the treatment protocols. So we get you into using the full functional medicine approach within phase 1, and so many practitioners are doing it within the first 2 to 4 months. And we also have medical coaches such as Dr. Ellis and Dr. Chael, who are helping you. They're working one-on-one with you on case studies so you can improve your clinical skills, right? And that's in phase 2. That's where we dive in more into geriatric condition and autoimmune and metabolic and all of that. So you're going to get, you're going to become the go-to person for your community when they struggle with these chronic conditions. So Dr. Ellis, guide us through into the supplements that we can recommend.
Awesome. Looking forward to it. All right. So we've set a really great foundation. We know that inflammation drives osteoporosis. The gut microbiome feeds inflammation. The food you eat impacts your gut microbiome, which feeds inflammation, right? So what are some strategies, some supplements and recommendations that you can give your patient to help turn the tides a bit? Well, the first product is a very popular product. I'm sure most of you probably have heard of it or used it in your practice. It is vitamin D3 and K2. Now, vitamin D3 and K2, I like to refer to them as calcium's Uber drivers. So vitamin D3, of course, it helps us absorb more calcium from our food. So when we're eating a yummy kale salad, if we have sufficient levels of vitamin D, or our patients have sufficient levels of vitamin D, we're going to be able to absorb more of that calcium. Now, vitamin K2 actually comes in and picks up calcium and takes it where it's supposed to go. So it deposits it into our bones and into our teeth. So we need both parties to help support healthy levels of calcium and support bone health. Now, what's interesting is there is so much research on vitamin K2, both the MK4, so the menaquinone 7, if you take a look at that supplement facts. Vitamin K2 comes in a couple of forms. So it can come in the MK4 form and the MK7 form. Now, those two forms behave a bit differently. But they both activate sort of the same proteins that are responsible for a healthy bone remodeling. And so when you're looking for a K2 D3 product, there are a couple of things you want to keep an eye on. You want to, of course, make sure that the vitamin D levels are in a good range. So, there's some that have 5,000 IUs. There are others that have 10. Make sure you're choosing one that can be easily dosed up or down depending on your patient's vitamin D levels. And then with K2, you want to look at the sourcing of K2. So menaquinone 7 versus menaquinone 4. It's the only difference between the two is how long the carbon chain is. And so that difference in 3 carbons does have a impact on the half-life of MK4 versus MK7. So if you're using a K2 that comes from MK7, that half-life is, I believe it's like 24 to 48 hours versus 2 to 4 hours with the MK4. So you have a significantly longer half-life. So your patient gets more of that benefit of K2 for a longer time. And then you also need to consider how the product or how that vitamin is fermented. So sometimes vitamin K2 products are fermented in soy. And so if you have a patient that has a soy sensitivity, you want to keep that in mind as well. But making sure that your patient has at least a vitamin K2 and D3 product in their regimen is so important. There was a 2020 review study that highlighted that MK7 specifically is able to improve the levels of osteocalcin. Now, osteocalcin is a protein that's only or mostly turned on by vitamin K2. It needs vitamin K2 to activate, to allow the calcium into the bone. And so if your patient doesn't have enough vitamin K2, it can make it a bit more difficult for, if it doesn't have enough of the MK7 form of K2, it's going to be a little bit harder to get the calcium directly into the bone. Clinical studies in postmenopausal women showed that a combined or combination of K2 and D3 supplementation led to increased lumbar spine and femoral neck bone mineral density compared to just D3 alone. Some research also suggests that the combo may reduce vertebral fractures, so not just in the spine or the hips, in their hips or lower back, but also the vertebral fracture risk can be decreased, and it also enhances bone strength. And not just the density. So both of those are equally important when supporting aging populations. So Dr. Tall, what supplement should we pair with vitamin K2 and D3?
Yes, absolutely. So there's the second supplement we're looking into is type 2 collagen. And there are different types of collagen, right? Depending on what's the source that it's coming from. There's collagen that is coming from fish, from chicken, from egg even, right? So eggshells. So we want to look at the type. When you talk about a certain condition for your patients, we always want to match what is the research showing us to be the best compound for your patients. Because unfortunately, so many of our patients so many patients out there, and probably your patients as well, are taking supplements, but they don't get any guidance into what they should take. So here's evidence-based recommendation. This is a product, and this is, again, we're not affiliated with any supplement companies. We just do our own research to provide you with examples of what would that look like from a professional grade supplement company. So you can see here a compound. This is called a BioCell. So collagen type 2. This is by a company called Claire Labs. And you can see different components here. They refer to it as BioCell collagen, right? So it's got hyaluronic acid and type 2 collagen. So collagen type 2 is a natural component of the cartilage, and it may aid in managing both the inflammation in the joint, and there are interesting studies showing that there is an improvement in the bone and joint. So one of those meta-analysis studies was published in the Journal of International Orthopedics in 2019, and it showed a significant reduction in this particular study. They also reported that there's anti-inflammatory properties that showed promising in alleviating symptoms in patients with osteoarthritis and osteoporosis. Right now, these are really two great products that we mentioned. So the type 2 collagen could be helpful. So if your patient mostly want to focus on osteoporosis, then the supplement that Dr. Ellis mentioned is great. If they also have joint pain or arthritis, then the second supplement, the collagen, might be useful as well. Now, I know that we talked about a lot, and I promised you guys that we're going to talk about milk products, right? So the question that we ask is, does drinking milk really beneficial for or essential, right? I remember growing up. I don't know if you had the same experience, Dr. Ellis. Growing up, I kept hearing this thing, like it was in the food pyramid, right? And I kept hearing from my parents used to tell me, "Oh, you got to drink milk, you got to eat cheese, you got to drink yogurt," and it was like
those got milk mustaches.
yeah, got milk. It's crazy. It's just, it was like this massive campaign that were spent. These companies were spending millions and millions of dollars into convincing us that we must drink milk. So now that we get a little bit more wisdom than we had when we were young kids, right? And a little bit more, a few years of reviewing research and learning a lot about clinical nutrition. I think we're in a better place to really ask ourselves, is this something that is beneficial, right?
Yes.
So I'm going to start by saying this is a very controversial topic, right? And it depends on who you're asking. If you're asking a licensed dietitian, they're probably going to pull some charts and some graphs and tell you that you must start your day with a glass of milk. And some of them still talk about morning cereal, which is like, I don't want to get started on that. It's just one of the, like, eating cereals with, the fruity, colorful cereal that has, all sorts of processed corn and processed grains, and it's just a sugar hit, right? So that's definitely something we don't want our children to be on, right? But it kind of begs the question: do we really need that glass of milk and keep eating cheese all throughout the day? That's what I kept hearing throughout my childhood. So, in the functional nutrition approach, this is really interesting. We look at studies, right? And now there are studies that are showing us that there is benefit in higher consumption of dairy products, right? And I looked at different studies. I looked at studies that are mostly focused on children, right? And then I looked at which typically are from infancy to 14, right? And then I looked at studies that looked at the older ages, like 20, 30s, right? And then I also looked at studies that looked at an older age. And what it looked like is there are a lot of conflicting studies. Some studies show that there might be a benefit. Some studies showing that there isn't benefit or very little benefit to consuming milk and dairy products. And so, for example, there's one study in particular that said that during childhood, if women that during childhood consumed less than one portion of milk per week, they had a 5% lower bone mineral mass in their 20s, between the age of 2 to 49, right? Now, yeah, so it's interesting, right? So there are some, and it's hard to say, right? Because those are retrospective studies. It's hard to say, there's so many different factors that we look into, right? Like we talked about inflammation, we talked about gut health, we talked about their current diet as adults. What's the level of physical activity, right? It's really hard to tell. So many factors play a role with it. But there's also studies that have shown that this one in particular was published in 2020, and it's in the Critical Reviews in Food Science and Nutrition. And they essentially said, this was a meta-analysis or systematic review, and they said that they concluded that greater intake of milk and dairy product was not associated with a lower risk of osteoporosis and hip fracture, which is the end results we're trying to prevent, right? So it's really interesting. When I looked at, try to get more concrete answers, the Physicians Committee for Responsible Medicine have basically stated that although the overall results are mixed regarding milk and bone health, most research showed no benefit to drinking milk for bone health, right? So I think the milk mustache, it just looks cool, but
Yeah.
does it have a benefit beyond it? It seems unlikely based on these different studies that we look into. So what the Physicians Committee for Responsible Medicine basically are saying is get your calcium, it's important,
Yes.
but get your calcium from greens, from beans, from fortified foods, right? And it's okay to supplement. It's okay to supplement as long as you're getting vitamin D. This is going back to your recommendation of the supplement. Vitamin D and vitamin K are really important. They actually mention here that when it comes to calcium supplementation, patients that took calcium with vitamin D had a 30% lower risk for hip fracture and 15% lower risk for fracture overall in comparison to those who did not take those supplements, right? So that's really important to know. So what we want to and why are we picking on milk, right? I mean, I love my cheese on pizza on a Friday night as much as everybody else, right? So in case you're thinking to yourself like, Tal, don't pick on my cheese. I want to tell you why I kind of talk about this topic, right? One, it's important to mention that over time, as we age, right, from infancy or childhood, the activity of lactase in our gut, which is the enzyme that breaks down the milk that we drink or dairy products, reduces by 60 to 80%, right? So our ability as adults to break down milk properly reduces significantly. And essentially what happens when you drink milk or eat dairy products, most of it will be not properly metabolized. It will go into your colon where bacteria will ferment it, right? So, which leads to some people, diarrhea or bloating or gas or all that stuff. So it's not broken down properly. Second reason is milk. Unfortunately, and this is something, Dr. Ellis, you already noticed, milk has some undesired product, like sometimes antibiotics.
Yes.
Lots of growth hormones that are being fed to these cows, different hormones, right? So we don't want those anabolic steroids in our body. There are studies that show that it contributes to development of certain cancers, that it's just unhealthy for us to do. And think about it, in nature, right? We are the only mammal that keeps drinking milk after we left the infancy, right? After we could stand on our feet and go gather food for ourselves, right? So it's I'm not going to say not unnatural, because I think there's, I always leave cheese for an enjoyment of, we going out and have some good food, or on a weekend we like our pizza, it's great, but use it as a spice for enriching your food, right? Don't rely on it as something that will help you. And this is again with the exception of the infancy stage and childhood. There are some good studies that show that there is some benefits during childhood for consuming dairy products and milk. So that was, I feel like we talked a lot about osteoporosis, and now you guys have some really great tools of better understanding osteoporosis, what's causing it, the root causes, and some supplements. So as usual, if you got questions, reach out to us. If you want to learn more, reach out to us. We're here to help you, guide you, to provide become the go-to person for your community. And we got so many different practitioners who are introducing functional medicine into their primary care practice. We got also nurses and pharmacists and different practitioners who are now building, and physicians building, consultation practices. So it's exciting. It's exciting times to be going into transforming your patient's health. So as usual, I want to thank each one of you for being here and grow and developing your skills and helping your community.
Absolutely. And we have a question.
Okay.
If you all have questions that you've written down, now is the perfect time to put them down in the chat. Here's our first question. Does it matter if D3 is in pill form or gel cap form versus oil-based liquid form? And what are your thoughts on high-dose D2 that gets prescribed a lot? Very, very good question.
Yes. Do you want to take that one, Dr. Ellis?
Sure. I'd love to. Okay, so D3, pill, gel cap, oil, or oil-based liquid. I think it's going to depend on your patient, their preference, and also their gut health status as well. So if you know that they're already having issues with digestion or showing signs of low stomach acid, you probably want to skip the pill or gel cap and go straight to a liquid. I'm kind of inclined to do the fat soluble vitamins in a oil liquid base because it's going to facilitate better absorption. It's already placed in a fat. And so that's going to pretty much drive it directly where it needs to go, especially if you're doing sublingual. So if you have a patient that perhaps they have very low vitamin D levels that you want to raise relatively quickly, an oil-based liquid vitamin D3 is perfect. And the pill or gel is great for general folks as well. Now, thoughts on high-dose D2. This is really interesting. I think that it's going to what's going to determine whether or not you choose high-dose D2 or just stick to D3 is really going to be, or actually I want to make sure that I'm understanding the question right. I want to make sure that you're asking about D2 and not D3. But if you're asking about D3, high dose D3, again, you want to look at your patient's levels. So if they're already, at a healthy vitamin D level, I'm really not too keen on going too high because that can actually damage bone health. And then with D2, you have to worry about the conversion. Does your patient have all of the micronutrients that you need to convert the D2 to D3? Is their kidney health in an ideal shape to help facilitate that conversion? So those are my thoughts on that question. Dr. Tall, what's your answer? Oh, you're muted.
Yep, it's such a good question about the vitamin D because there's a lot of misconceptions in the supplement industry, and I feel like a lot of there's sometimes I look at supplements and after kind of researching supplements for over 20 years, I start to see how sometimes supplement companies are, they got, I like to call it like slippery slope, like they go into these little slips of like, oh, this is like amazing for that, this is amazing for that, and so when it comes to your recommendation of like vitamin D in oil-based soft gel, it's probably one of the best ways for patients to consume it. And if they don't want to do that, then another way is because it is fat soluble, right? Another way to do it is to consume it with fatty foods. So, I mean, most foods, if you prepare it with a little bit of oil, will have, or most foods have some fatty acids in them. So it's going to be helpful to consume it with protein or fatty foods. Helps with absorption. And then one thing that I'll just add to that is that there's such a strong focus on vitamin D, right? And I noticed in the chat they added vitamin D to 50,000 units. I'm just going to say that it really also depends on what's the vitamin D levels of the patient.
Yes.
So before we go into like supraphysiological dosages, there's very few times when we'll go into such a supraphysiological dosages without knowing what's the patient's current status, right? It really depends on what's the current status. So a simple vitamin D test can let us know. But I want to, when we take vitamin D, we often had really good results when we look at the whole picture. So one of the things that, I'll give you an example. One of the things that we had is a patient. We had a patient. This is a case. Patient that came to see us, very bad osteoporosis. She was taking medications. She was taking high amounts of vitamin D, high amounts of calcium. Everything she was reading, everything that Dr. Google was telling her to take, she was buying. She had all sorts of supplements. She also had constipation. And I asked her, have you been taking magnesium? Right. So, of course, we worked with her on figuring out the root cause, and we did find she had inflammation and she had all sorts of stuff that we had to take care of. Right. But when we added magnesium, right, it was one of the things that started shifting things. Right. First of all, she started having more bowel movements. And second, I explained to her that magnesium is essential for bone development and mineralization. And many of us forget that. So magnesium, and there are studies that are showing that if your patient has lower magnesium intake, which a lot of Americans do, it is associated with lower bone mass density. So this is really important. Now, how does it work? We're not going to get into it too much. We have classes specifically on nutritional medicine. But for now, just remember that magnesium is required for the activation of vitamin D. Without magnesium, your patient can be taking very high amounts of vitamin D, and if they're deficient in magnesium, it won't be utilized by our body. And there is a specific test to measure what our cells are actually taking and utilizing. It's a specific test in functional medicine. I'm not going to get into it because it's a whole different topic. But we have the tools to measure. We have the tools to look at the effectiveness. I would say for now, look at the whole pictures. We talked about some important nutrients, and when you combine them together, in many cases, you don't need such high amounts of vitamin D, right? And this is in that particular patient's case, what we did is we didn't want to go higher and higher and higher in the vitamin D, because we understood that if we're missing other things, right, like other nutrients, or we're missing what's driving the inflammation, she's not really going to get the solution that she's looking for, right? So so I think we had, I mean, it was a really good discussion. So I'm really glad that we were able to come together and talk about this topic.
Absolutely. And you talked a bit about how supplementation can kind of turn into being used as pharmaceuticals, almost like a Band-Aid, without getting to the root of what's going on.
Exactly.
Yeah.
So it is that's something we go into a little bit more when we talk about, I'm going to be talking about on Monday. I'm going to have a class on the 3 levels of care. So again, that's one level is, okay, let me give you a natural alternative to metformin, a natural alternative to whatever it is, right? But, and that's okay. That's helpful for the patient, right? But there's other levels of care, like the root cause, right? The more dietary, integrative lifestyle approaches. There are different levels of care. So we always want to address all levels of care, because the osteoporosis is a long-term condition that could be impacted by so many other factors, right? So that's why we will try to get to you the most essential information, so you can start kind of really diving into this topic and start helping your patients in a more meaningful long-term approach. So
exactly.
Yeah.
Thank you all for joining us tonight. We hope you enjoyed it. Please leave any comments or questions, and we look forward to seeing you next week on the next episode of the Functional Solutions Podcast. Have a great day. See you next time.
Thank you, everybody.